To me, the when you're kicking people out of therapy for majoritarian political views, that's a canary in the coal mine, that the bias situation has gotten much more severe. The therapeutic relationship is very intimate. It's very personal. You really have to be open and curious and empathic to people with a wide range of views. You can't kind of just fake it or not have knowledge or have real hostility and do good work.
Andrew Hartz, welcome to Heterodox Out Loud.
Thanks for having me.
It's really a pleasure to have you here. You're the president and founder of the Open Therapy Institute, which we'll be talking about. That's our main topic today. You're also a long-time Heterodox Academy member.
That's
you taught at Long Island University for a while. Can you tell us a bit about your connection to HXA?
Well, I joined as a graduate student, and I remember learning about Heterodox Academy when I was a PhD student. And at the time I learned about it, you couldn't join unless you were actually a teaching faculty member. So I remember emailing saying, can graduate students join? Can PhD students join? How does this? And they said, not yet. And then I remember about 6 months later, they opened it up to PhD students, and that's when I joined.
So it's really lovely to have you on the show. Tell us about the Open Therapy Institute. What is it? What problem is it meant to be addressing?
So Open Therapy Institute is focused on sociopolitical bias in mental health care. So any way that basically political bias is impacting therapy, we want to address.
So political bias impacting the therapy. Can you give us examples of that?
It really runs a spectrum. I kind of like to think about it as having like basically 4 levels of bias. One would be activist therapists, which do exist, where they might explicitly think that they should bring their political ideology into sessions and maybe proselytize to their patients or even reject patients from therapy if they don't have the right views. I'd say the next level of bias would be therapists who they're not doing that, but they have very strong political views. They're uncomfortable talking about certain topics. They might be very judgmental. They might be hostile to certain views. They might have rigid stereotypes. That would be like a very biased therapist. The next level of bias would be somebody who really means well, wants to be a really good therapist, but is maybe they don't know how to treat patients with different views. So like they don't understand things about different experiences and perspectives that patients might have. And what we want is to get to a place where therapists are skilled and knowledgeable, working with a wide variety of patients.
So let me ask this a little more tightly, because what you just described seemed to me to be a description of the range of human types. There are people out in the street. If I walked out here on 6th Ave, I might find people who fall into all those characterizations. But we're talking about people in a professionalized context. They're putting on their persona as therapists, and yet they're still falling into the categories you just described. There are people who, as therapists, when they walk in that room and switch into those professional norms.
Yeah.
So what I'm asking about is what are the professional norms of therapy?
Yeah.
Are these people flouting the professional norms, or are these the professional norms?
Yeah. So for over half a century, the standard in mental health has been treatment should be patient-centered, should be focused on the patient's goals and values, and the therapist or the other provider should be attuned to the patient's values. Where things have gotten derailed, I think, in the past 10 years or so, it really comes, I think, for the people who are activist therapists, the way that they would probably frame it is they're confronting racism. So obviously, if you have a racist patient, you'd need to address that. That's totally reasonable. There's nothing biased about confronting racism. There's nothing biased about confronting sexism or homophobia. So those are reasonable things for therapists to do. But their definition of what racism is and what sexism is more and more expansive. So disagreeing with affirmative action policy, well, that's racism. Got to confront that in session. Voting for Donald Trump, that's racism. Your views on immigration, that's racism or sexism. So the views get very expansive. And then now all of a sudden, the therapist is kind of using their role as a therapist to kind of weigh in on a wide range of ideological issues.
But let me be sure I understand. So how is patient-centered therapy compatible with responding to people's racism and sexism?
I don't think that they're compatible. I think the field has drifted away.
But I'm sorry, I don't mean to interrupt, but I thought you said that it's okay and reasonable for people to address people's sexism or racism. But the problem is that people are defining those terms so broadly now. But I'm asking about the core case.
Yeah, no. I think for the people who practice what I would call like an activist-oriented or social justice-oriented psychotherapy, that's what their rationalization looks like. So they would rationalize it as, we are still basically being patient-centered. We're not really being biased. We're just addressing racism. I think that's how they would describe it. The problem is exactly what you're saying, which is that it's very easy, once you bring that into therapy sessions, it's very easy to stop being patient-centered and for it to be a slippery slope to disagreeing about every political issue that exists.
So is there a space in therapy for moral judgment of your patient's views? Moral judgment. So a person has a view about women, for example, and the role in society.
Yeah.
Is there space there for that and a healthy therapeutic relationship in your view?
There could be. I mean, imagine like a very narcissistic patient who is being very aggressive towards women, and or it could be a narcissistic woman who's very aggressive towards men. But there might be a way to say, that worldview and that stance is creating problems for this patient, and that being candid about that is reasonable.
So goals of their own, for example, to have a long-term relationship or to have healthy relationships with their children, goals of their own might be thwarted by things and thought ideations and patterns that they have.
Yeah. Or even just like feeling grounded or emotion dysregulation stuff, or why aren't people getting along with me, or what, like it would probably, if they're acting in like a pervasively aggressive way towards people, it probably is impacting their life negatively.
So thanks for that background for me. Yeah. That's helpful.
Sure.
It's helpful to me. So let's move now to the Open Therapy Institute and what you're seeing out there. Can you give us some examples of therapeutic interventions or experiences that have come to your attention that motivate your work?
Yeah, I mean, increasingly, especially in professional bodies and in a lot of training programs, therapy students are taught that every therapy needs to broach race and issues like white privilege. Every therapy needs to conceptualize the patient and therapist as privileged or oppressed based on certain demographic categories. Often they're taught to think about race in terms of or gender in terms of these very preordained scripts, where the Black patient is their chief problem in life is racism from white people, and they have a whole set of beliefs and values that are shaped from that, and the therapist needs to view them in a particular way. So I'd say these ideologies are really intensely coming into training, and a lot of those ideologies are explicitly advocated by professional bodies in the field.
Can you give specific examples? Are there particular cases that stick out in your mind?
Of like therapists actually doing this?
Yeah, therapeutic experiences of patients where they're getting this kind of care.
Yeah, we're emailed weekly by patients, several times a week by patients looking for a therapist to report things like this, and it really does.
Give an example.
I wrote an op-ed about that had one example where I was at a clinic where a patient said that he disagreed with affirmative action, and I guess the situation was he didn't get a fellowship.
This is a Jewish patient, as I remember.
Yes, it was a Jewish patient, and didn't get a fellowship, which he felt was because of affirmative action policies. And the response to so we discussed this case in a case conference that was probably 2 or 3 dozen people with social workers, psychiatrists, everybody in the field, and there was an apparent consensus that the patient was racist for having this view, and that because of that, the patient needed to be referred out and seen elsewhere. That the therapist, who was a woman of color, couldn't be expected to see such a racist patient. They're not.
I'm sorry, let me catch that.
Sure.
So that the therapist professionally should not be expected to deal with a patient with those kinds of.
Yeah, and it exactly shows the slippery slope of the racism thing that I was talking about earlier, where it's like, yeah, if you were a Black therapist and you're treating a patient who's an actual white supremacist who is bombarding you with hostility for your race the entire time, you actually wouldn't be expected to do that. On the other hand, having a fairly run-of-the-mill opinion about affirmative action, that probably a majoritarian opinion, is a totally different thing. And there's this conflating of the two that can lead them to really, really mistreat patients.
That's fascinating. So how widespread is this phenomenon, and is it geographically, does it arise in red states and blue states differently? Just how widespread is this issue?
Yeah. I would guess that it is different in different regions, although I don't know of any data supporting that. I think, maybe less recently, but definitely in the past 10 years, if you were on a therapist listserv, like therapists have these email lists where they will look for a therapist for a particular patient. And there were lots of people who would openly say they would not see a Trump voter.
Would actually say that.
Say that proudly. I mean, and lots of people said, but and recently, I mean, there was a news story in Chicago. There was a group of therapists who said they wouldn't treat a Zionist patient, and they actually identified therapists who they suspected of Zionism and said they wouldn't refer any patients to therapists who were suspected of being Zionists. So there's definitely a influential wing of the therapeutic world that is pretty strongly behind these ideas.
So I'm just fascinated by that because, as you know from your involvement with Heterodox Academy, one of our main ideas is that the university is in some sense a special place, separated from the ordinary run of politics, a place where people can go and put their guards down, join in conversations with one another, with humility, recognizing the things they don't know and want to learn, speaking openly about their weaknesses. But all of that depends upon the forces of politics, of ordinary politics, not washing over the walls of the university and covering up the campus.
Right.
But I think in many disciplines, many professions, that's the case, or it should be the case, that same ideal that this professional area, say in law, for example, or in medicine, or in therapy, that if politics is allowed to wash over the walls, so now you have doctors making decisions about their patients based on their political views, what treatments they get them, whether they see them at all. Right. Or you have lawyers saying, I won't take clients of these different categories, or I think no one should take a client of that type. That just is a destruction of the profession. But in therapy, what do you see there? It sounds like that washing over is there anything pushing back against that washing over?
Well, I mean,
professional norms, for example.
Just to kind of like underline your point first about how damaging that worldview is. I mean, I think the bias has to get pretty bad before you get leaders of professional associations advocating this type of what I would say is extremely politicized approaches. So all the other layers of bias that I mentioned at the beginning, I think they've been there for a while. And they've really ossified into something else. To me, when you're kicking people out of therapy for majoritarian political views, that's a canary in the coal mine, that the bias situation has gotten much more severe. The therapeutic relationship is very intimate. It's very personal. You really have to be open and curious and empathic to people with a wide range of views. You can't kind of just fake it or not have knowledge or have real hostility and do good work. So I think it's the tip of the iceberg of this huge iceberg of bias, and I think there's a lot more under the water. What's the pushback like? Therapists are very scared to speak out about these issues, and the biggest fear is that if they talk about problems in the field, they will not get referred patients. They're worried about other things. They don't want to lose friends. They don't want to be attacked. They don't want to get sued by patients. If they find out you're a conservative or you have a conservative view, then maybe somebody will file a complaint with your licensing board or something. So they tend to have fears like this. I don't know how common those things actually are, but therapists are very worried about them.
But isn't there an official body that sets professional norms, states professional norms? Is there a group that says therapy is a specialized place? It's not the place for you to do political campaigning or other kinds of moralized. Are there leaders in the field who remind people of what the ideals are professionally, but the ideals are being not observed and being observed in the breach rather than being supported and reinforced? Is that the way therapy works?
I mean, it's probably the way it should work. But a lot of the professional bodies are some of the most politicized parts of the field. I mean, the APA, there's the Association for Social Workers, for counselors. There's university training programs. There's psychoanalytic training programs. I mean, so many of these have gotten really aggressively politicized, and it's actually running the risk of kind of death spiraling because people don't want to enter the field to go through a graduate program that's very intensely politicized and hostile to them. So if you're not on board with these ideas, the idea of spending 3 to 6 years in graduate school, having to self-censor and feeling attacked, it makes people say, I'm not going to enter the field. So it's kind of already reached a very radical point, but I think it has the potential to just kind of continue to spiral.
It's fascinating. And so now tell us about the Open Therapy Institute.
So the Open Therapy Institute, so I think one of the things that was on our mind when we were founding the Open Therapy Institute was not limiting the discussion to just the most extreme forms of bias. We do want to talk about those. They are really important. They're happening more than people probably could imagine. But we wanted to talk about the other forms of bias too. The way that therapists might make assumptions about patients, that could be pathologizing. Oh, you're a Trump voter. It means you're a narcissist, or it means you're dumb, or whatever, or other biases that they might have. This group's privileged, or this group's, always a victim, or something. And we wanted to actually think about what are all the different ways, what are all the different issues in mental health where bias manifests, where things might not get addressed and talked about that could come up in sessions. What are all the different ways that bias might manifest? It could be, a faith-based issue. It could be around religion. The field is very secular, very atheistic field. I think I saw something that's most atheistic profession, which kind of surprised me.
Fascinating.
But
that's fascinating.
But most patients aren't. So there's a big gap. And a lot of, like when I was in graduate school and I did my PhD, I didn't have a single lecture on religion.
Fascinating.
So most therapists that I know in New York don't ask about religion in the intake. They don't ask. So it's and then if it did come up, I think a lot of them have the assumption that being culturally competent around religion means being nice about it. So you're nice to them, but you don't know anything about it. You don't engage them with it. You don't have faith-based interventions or suggestions. You don't bring it into your formulation. You don't have any thoughts about it. And so I think that's an example of the type of bias that's happening around other things. And it could be politics, it could be self-censorship, it could be masculinity issues, it could be racial issues. We had somebody who's giving a talk in a couple months who's talking about gun owners. There's a history in mental health of pathologizing guns and gun ownership. Gun owners know this. They're very mistrustful of the mental health profession. They're worried that they're going to get reported and red flagged. And so gun owners who need therapy are often very mistrustful of the field. And that's true for dozens and dozens of populations like that.
Does that mean, and with gun ownership, is that happening? Does that happen because historically because of the connection between gun ownership and successful suicide? That's one of the arguments against gun ownership is that it's a complicated issue, but one of the arguments is that if you have a gun in the house and you are having suicidal thoughts, there's some evidence showing that there's a higher likelihood you actually will successfully kill yourself.
Yes. So
is that the roots of that?
I mean, that's all the more reason why we have to have excellent mental health care for gun owners. And we have to have a great relationship with gun owners so that they get treatment and so that we reduce those numbers. I mean, like we should have great trainings so that gun owners get superb mental health that's culturally attuned. And that means, they have a gun for safety reasons, or they have a gun because they like to hunt, or they like the antique or whatever it is. You can be curious about that. You can be warm about that. Of course, you need to prioritize safety. If there's a suicide risk, you need to address that in an assertive way, the way you would with another patient. But we should have a much better relationship with gun owners than we do.
And on the religion topic as well, it fascinates me and it surprises me deeply, because I would think that in a therapeutic context, understanding people's deep connections to the world, how they see themselves, the world, how they situate themselves in the universe, how they root the importance or unimportance of their life. Religious people have those resources in a way that are distinctive. And it seems like such an obvious opportunity for therapeutic connection and drawing people through.
Exactly. And for interventions. I mean, there's a lot of research, and look, I'm a big meditation supporter. There's a lot of research on meditation, and I think that's great. I'm a big fan of it. Compared to prayer, I mean, the focus of the field on meditation versus prayer is very stark. But there's similar, and there's a lot of benefits to prayer and thinking about prayerful meditations and faith-based meditations. And it's just clearly addressed much less, I think, obviously because of the secular bias in the field.
Yes, it's fascinating. And can I just ask you to think about, to talk with us a bit about how you see the broader cultural moment? Because I would say that with Donald Trump's presidency and the whole Trump phenomenon, and we hear about Trump derangement syndrome, which is apparently a therapeutic, quasi-therapeutic term.
Right.
But also just the polarization that a figure like Donald Trump sort of generates. Also with the DEI trainings now in workplaces, which talk about different kinds of racial responsibilities and the idea of toxic masculinity. There are a lot of forces and ideals out in our society that people are encountering that seem to put some groups on the defensive. So there's maybe a greater need there's a therapeutic moment, perhaps. Does that seem right to you, or how do you see that?
I mean, if you go back 15 years, if a patient came in and wanted to talk about politics every week, that would have been diagnostic. It's like, what are you avoiding? What is this about? Why are we talking about politics every week? It's not abnormal anymore. It's clearly on people's minds a lot. I think it's a source of a lot of distress for people. When people, Trump derangement syndrome is obviously like a pejorative term.
Yes.
I think there is something that people are actually seeing, which I do think happens on both sides of the spectrum, where people get very emotionally dysregulated around politics. And I think often lose their grip on reality testing, start to believe things that aren't implausible. They can become paranoid. They can damage their relationships in a severe way. People are noticing a certain type of maybe pathologies, that's related to politics that they're seeing more, for sure. And I think the DEI trainings, it brings politics into the workplace, into school. A lot of those trainings have a lot of hostility. I've been to trainings personally that were overflowing with hostility towards certain demographic groups in certain parts of the country. there's just more and more ways that people are impacted by these ideologies. It affects dating, it affects their family and their relationship with their kids and their parents, and it's shocking. I'll tell you, one thing is shocking is how many patients think they're not supposed to talk about politics in therapy.
They think they have a responsibility as a patient not to do that.
That they're not supposed to, and they think that about religion too. Some think they're not supposed to talk about religion too. It's a lot of them do, and that's what therapists actually have to do a little bit of work to open up. That if those are things that are on your mind that are impacting you, it's okay. It's probably good. It's probably necessary to talk about those at least a little bit. But a lot of people think they're not supposed to, and they self-censor, and they probably underestimate how much the entire therapeutic process can be derailed when you're self-censoring parts of your life like that.
I read someplace, I think maybe on your website, that you created the Institute to address polarization in mental health care. Is that a formulation that is familiar to you?
I don't think I framed it that way, but I'm curious where you're going with this.
Well, so that's from what you just said. That strikes me as an accurate account of that line I just mentioned about addressing polarization. Polarization is something that I think can have the effect of creating loneliness for people, creating dysregulation, as you talked about, feelings of extremist thinking. It's the end of the world if Harris wins, or it's the end of the world if Trump wins.
Right.
The end of our society, the end of America as we know it. Both sides seem to use that kind of rhetoric. It's Hitler coming, or it's communists coming, the Marxists are coming. So there's kind of this extreme thinking happening in a polarized society. And I would think that in cases of polarization, there's perhaps a greater need for therapy, and a special kind of need for people who are feeling lonely, feeling beat up at work, trying to understand what their role is in a society with a very complex and in many ways horrible racial history. Right. What does it mean to live in that society and still be the person you are, right? And have an appropriate understanding of, are you responsible for all of this? Are you a good person? How do you live your life? How should you move through the world? I mean, I gather those are triggers for the need for therapy. And then we're talking about when they get therapy, they don't actually get the responses that they might be getting.
Right. Well, I mean, I think you and I were talking earlier about how with all the kind of like political chaos that's happened over the past decade in particular, and I feel really strongly that tools from psychology, and maybe clinical psychology in particular, can really be indispensable at diffusing tensions, fostering dialogue, helping people understand, helping people repair, helping systems become more functional. And I think it's been a huge missed opportunity that the field hasn't done more work to foster that. In terms of polarization, like I would say the country is very polarized, and people are feeling that. The mental health field, I think, is less polarized because there's just one pole. There is no counterpoint. You do find there are individual therapists who are right wing and do things that I would consider unethical, politicizing sessions. They exist, and they say crazy stuff too. There's definitely some of that. But I think like psychology professors are 17-1 liberal to conservative. I think therapists are 90, 92, 93% liberal to conservative.
Wow.
The conservatives tend to not write articles, not speak about it, not teach about it, be in the closet about it, self-censor, and so
viewpoint diversity is a massive issue.
It's a massive issue, and there's only it's very unequal, and so there's that's the issues that tend to get ignored, and the perspectives that tend to get ignored are almost always on the center and on the right.
Are there other systematic biases in the profession that might be related to, for example, socioeconomic class? Do we know about that, or gender?
Well,
is there
gender for sure, because the field is really female dominated, and I think it's 80% of therapists are women. That gap is getting bigger, and I'm actually having second thoughts if it's exactly 80%, but it's something in that ballpark. Child therapists, it's even more extremely geared towards women, and men's issues are often really mishandled. I mean, the place where I see it, I'm particularly concerned about it is couples therapy. I'm very concerned about biases against men in couples therapy, that so many couples therapists are women. They don't understand men's issues. They might pathologize men as being more aggressive, as being less supportive, as being more narcissistic. They might undervalue men's needs in relationships. And it shows there are all of these subtle ways that bias can come into sessions. It's not always like the big sledgehammer of explicitly politicizing a session. It could just be like a tendency to stereotype men as the bad guy in the relationship.
Fascinating. As you were speaking just then, I was thinking about parallels with teaching. That in teaching, we're trying to help people think. We want to impart to them a body of knowledge so that they can think for themselves. We want to give them tools so they're able to find their own direction. And at HXA, we're often charting the various biases that have been implicit or even explicit in the way teaching has occurred in America. So, for example, 50 years ago, there were very few Black professors, very few women professors, and that affected the way people would interact. And now we've done much better to integrate and be more inclusive in those dimensions. But there's new forms of bias and collective group thinking that have been occurring that are very damaging for teaching. And therapy seems to have some of the similar kind of patterns going on, right? It's fascinating.
For sure.
There's a professional in the room, as with a teacher and a therapist, and then there's a student or a patient. Kind of interesting how that relationship, there's parallels between those two sets of relationships. I wonder if you could just tell us a little bit more. There's a big report I know you've been working on at the Open Therapy Institute. But just tell us a bit more about the Institute itself first. Who are you? Who's involved with it?
Right.
What is it a membership network? How do you operate so far?
Yeah.
And when did you start it? What year?
We started 2024. We founded
you just
this year. I
didn't realize you had just begun.
We announced in 2023 that we were starting. We've officially got incorporated in January.
Oh, fast.
So
congratulations.
Thank you.
I did not realize it was that new of a venture. I thought it was 2 or 3 years.
It's taken, it takes a while to get the team together and get everything moving. We have such a superb team of faculty and therapists from around the country. And
so what's the model? Is it a membership organization? How do you work?
Okay.
Or how will you work? What's your vision?
We are trying. Maybe I'll kind of like tell you the sequence. So we have this report. We're trying to document issues that are overlooked because of sociopolitical bias. Any of the issues we were talking about: self-censorship, cancel culture, gender. And then we do continuing ed trainings for therapists that are accredited, that therapists can take to get their continuing ed credits. And those therapists can also become members of a network. It's just open to therapists. And we have a monthly peer consultation group. We'll probably add and do more peer consultation groups for therapists there too. So the focus is research and training and supporting therapists.
And did you need to get accreditation to be able to provide these courses?
Yeah. Yes, we did.
Was that a complicated process? You started in January and you already have it?
We already have it. We got it.
It was fairly smooth.
It was, no big issues. I think we were worried about potentially being politically targeted, but we have like Ivy League faculty giving talks on underserved populations, and we have an incredibly diverse group of people, like politically, racially, religiously.
Are Heterodox Academy members part of your core?
Yes, yeah. It was a lot of people that came out of it were connections from Heterodox Academy.
So,
Mike Strambler was a Heterodox Academy writing fellow. Sally Sattel, Pamela Peresky, who we talked about, Camila Ortiz. We had so our initial group was like mostly Heterodox Academy people.
Interesting. And so go on. Tell us more about you.
So the main. I do think we were talking like how does this problem get fixed in mental health? I mean, I do think long term the problem is going to be through the market. The supply of therapists is not meeting the demand. I think there's a market-based solution where they get paid more because of the supply-demand mismatch. It attracts more therapists to do this work, and that the private sector can be an engine for correcting this problem. But for that to happen, there has to be a way for therapists to actually get trained on these issues that they've never had training on. That's why we want to do the report outlining all these issues, trainings on these issues, and then the groups for members where they can talk through and support each other as they learn this new material.
So that's working on the supply side, supplying therapists who are trained in these ways to see these biases, to be aware of them, sort of thinking about ways they can provide better therapeutic opportunities for people. On the demand side, I wonder, do you work there as well? Because I would guess that a lot of patients aren't really quite aware of how off things are. They go to a therapist and they start getting effectively told that their moral views are wrong and their political views are suspect, and they're to speak now in therapy. Is there a demand issue, or is there a market from the demand side?
Yeah, I mean, there's a poll, and I don't have the specific data on it, but and I hope we'll tweet about this soon, but there was a national poll that was done recently that I think it was 38% of the country is concerned about therapist bias. So the word is getting out.
It's amazing.
The word is getting out that this is an issue. I think when people actually learn how bad it's gotten and they actually see what these professional bodies are saying and writing, I think that number could double. It's a real issue. I do think patients have some misconceptions, like they don't talk about politics because they're worried about judgment, so they'll just hide it. If they have a concern about, bias against men or affirmative action or something, they'll just self-censor around that issue, or they just won't talk about their religion.
Even if these are things or experiences that are really on their minds and causing a lot of psychological discomfort,
yes,
they still won't speak about them.
Some, or they just, or not even not speaking about them. They won't even look for a therapist. They won't even go because they're all woke, or they're all, and so I think a lot of people are losing confidence in the field. If you do want to find a therapist and you're like, okay, I'm going to want to talk about some of these issues because they're impacting me. Maybe I'm a student and I'm feeling attacked for my beliefs. I'd really like to talk to a therapist who knows something about this, or where I can be open about this. Where do you go? I mean, you kind of like, you're going on Psychology Today, taking a stab in the dark. Okay, this person's profile doesn't seem too political. We'll check this one. If you go to Psychology Today looking for a therapist, this is true the last time I checked, at least, a majority of therapists in New York, right after their name, it's their pronouns. The first thing after their name is pronouns. Now, I know a lot of therapists who do that, and a lot of them, they're required to do that from their work, or maybe they feel like, I'm being inclusive. This is an inclusive thing to do. They're, for the most part, totally oblivious that it's sending a signal to a lot of patients that they adhere to a whole constellation of ideologies that the patient doesn't adhere to. But it sends a message to a lot of patients where they look for a therapist and everyone's got their pronouns and they think therapy isn't for me.
Tell us about the report. So you've been working on this sort of a large scale report. Just tell us what's in it. What's the objective for the report?
So the report was to document issues and perspectives that are underaddressed because of sociopolitical bias. So we identified, we've already kind of talked about a lot of these, but we've identified 50 issues for this first report. Every issue has tons of clinical questions that aren't answered. So if you just take the issue of self-censorship, like what in society contributes to it, how do institutions foster it, how do people experience it, how does it come into therapy, how do therapists respond poorly, how could they respond better, what interventions could help from different theoretical perspectives, what reforms of institutions could change things, how does it impact group dynamics. There's so much just on that issue. And we don't have case studies, lit reviews, theoretical papers. We don't have interventions that we can test. And we could look at those from what do those come from a behavioral perspective, from a psychoanalytic perspective? I'll give you one example from one of our talks. There was a behaviorist, and he was talking about the idea in one of our workshops about doing a behavioral experiment with self-censorship. Like, try asking a question and see what happens. And you start to do these behavioral experiments. Maybe it's not what you think, but kind of this systematic approach to doing behavior experiments to confirm or disconfirm your beliefs about what would happen if you spoke up. So, I mean, these interventions, we can develop lots of interventions that are effective for different people, just on that one issue. But the same that's true there is also true for racial issues, gender issues, trans, sexuality, politics, cancel culture. Every one of these issues has dozens and dozens of topics that need to be addressed. So we're starting with just 50. We're doing really short articles. They're about 1,000 to 1,500 words each, very dense, just to kind of get the conversation started on what interventions for self-censorship look like. How do masculinity issues come into couples therapy? What are specific issues that young men might be facing? What are racial issues at the workplace that might be under-addressed? So we're just trying to document those issues. I think the main thing that I would want to say that is the pitch to Heterodox Academy on this is I really think every discipline in academia could write a report like this. Public health, education, sociology, humanities, every department could write a report on this.
And let me make sure I understand your suggestion, because I'll be talking about it with the team.
Okay.
You're suggesting sort of a landscape analysis of what the patterns of bias are, field by field. Is that what you meant?
I think it's drilling down into specific issues. So if you identify what are, and a lot of this, it's all a work in process. So sometimes somebody comes up with an idea, we never thought of it. But then it's like, oh, that's a good point. I never thought about how that issue would come up. Like, what? Here's one. Polyamory. As a therapist, I see more and more people who identify they're practicing polyamory. What is this about? How does it impact them? There's questions, and I think often the sociopolitical bias in the mental health field is you always have to be approving and affirming, and you can't really think clinically about maybe this has maybe this is a reaction to trauma, maybe this is an avoidance of intimacy, or maybe this is something else. New things are constantly being suggested by scholars to us that we'd never considered, but 50 topics is nothing. Like we could come up with hundreds and hundreds, and I think every department could.
And we're coming down toward the end of our conversation. What's the opportunity in front of you? It just seems like there's incredible. On the downside, there's a really bad situation with therapy. How do you see the opportunity? Do you see yourself more as creating an alternative to standard therapy, or are you trying to change what standard therapy is? How much are you reformers, and how much are you? I'll put it this way: how much of you are HXA, reforming an existing institution from within, and how much of you are UATX, building a separate institution elsewhere? How do you see your role? Can I ask it that way?
Yeah.
We love UATX, but I'm just curious.
Yeah.
How you see it?
I think, the opportunity really is tremendous. There's so much fascinating work that I think can really help people. And actually, when we write about it and it gets hopefully disseminated into the larger culture, it has a cultural impact too. We are probably more like the University of Austin model, if I have to just pick one. And the reason is, I think it's really hard to think about how to reform some of these existing institutions. I would ideally like training on working with diverse viewpoints, training on working with, maybe we would call them patients who are underserved because of sociopolitical bias, training on how to treat those populations. I would like that to be required in every therapist training program in the country, from master's level to PhD level. I would like that to exist. We need to do the report first. Hopefully that becomes a book. Then we can get a textbook. Hopefully we can get a curriculum. This is the step of how we get there. But we want to cultivate a team of faculty that have expertise in different issues. Oh, this is our masculinity with young men person. This is our faith-based interventions person. And we get these different specialists really being experts on this, doing talks and writing articles on it, and then we start to have something that looks like a faculty that can actually do this work. But the changing the system from within would take a long time to get those programs established.
The challenge with changing the system from the change from within strategy is always try to, if the powers that be within don't see the problem as a problem, then it's very hard to get traction to make things start to happen. In the academy at HXA, we think that in the last year now, there's much more of a recognition because the public opinions focus on the universities and some of the dysfunctions at universities. There's an opportunity, a special opportunity now for that. I'm not hearing you say that there's something similar in therapy, or am I missing that? Is there, you're saying a lot of, there's a widespread understanding there's something wrong with therapeutic models as they currently exist, or current therapeutic practices as they currently exist, I gather. But that watershed moment hasn't, you're not going to have the presidents, like the college presidents up there on trial for all the world to see, okay, something's really gone wrong with this organization. Is there any kind of moment like that? Can you imagine a moment like that?
Well, with the transgender stuff is probably where a lot of this starts and where people start to become aware of sociopolitical bias. Because, when I was in graduate school, like I remember when it was kind of rolled out that you were supposed to be affirming. And I was like, I'm not seeing any studies I'm not seeing any randomized control trials here. Can I see a longitudinal randomized control trial that this therapeutic intervention is actually better? And people in the field, I knew lots of psychologists and psychiatrists who had the same questions and were afraid to ask. And meanwhile, it's announced to the public that there's this broad consensus in mental health care. Now it's actually coming out that no, we don't have longitudinal randomized control trials. And lots of people got surgeries and regret it or were impacted by it, including kids. That's a place where people can start to think more about how sociopolitical bias is impacting mental health. And then maybe they can start to see it. Oh, there's analogous issues also.
That's fascinating. I wish you well with the Open Therapy Institute. It's really a pleasure to have you here at the Siegel Center. Thanks for all the work you do.
Thanks for having me.
Thank you for tuning in to today's episode. Heterodox Out Loud is a nonprofit production of Heterodox Academy. We rely solely on support of listeners like you. If you enjoyed today's episode, please follow our podcast, leave a rating or a review, and share it with your friends and network. Your support helps us reach more individuals who value diverse perspectives in higher education. If you are in higher education, visit heterodoxacademy.org and join the thousands of professors and students from all around the world who are working to support open inquiry. Until next time, I'm John Tomasi, reminding you that great minds don't always think alike.